Okay, so welcome everybody. I am Maria Antoniadou, an associate professor at the Department of Dentistry of the University of Athens. And today we're hosting a new webinar with Dr. Alessandra Sata on resilience just for women in healthcare. With Alessandra, we have designed this female resilience program in the Center for Continuing Education of our university that would be launched on October. All our team has a female workforce, and we aim to empower exactly our fellow women colleagues in matters of resilience, leadership, and sustainability issues. Of course, based on our expertise as coaches and mentors, both of us, all of us, and our experience in relevant research of the theme. So Dr. Alessandra Sata is a seasoned educator, consultant, coach, and mentor, specializing in generative change and women's empowerment. And she has a background in science, technology, and leadership, also resilience themes, as we are going to see. And she works on personal transformation and collective intelligence, particularly among modern women. And she's formerly a program director for Professional Women International in Brussels. And she's working on initiatives to nurture female leadership in STEAM fields. But actually now we have it here in the healthcare sector to work on themes that are especially for women. And she is using for this purpose various coaching and leadership methodologies, facilitating growth and collaboration across diverse cultures. So I am really honored to work with her on this project, and find it so interesting to work also with all of you. So Alessandra, welcome, you too.
Hello, welcome everybody, and thanks Maria so much for having me here during this webinar and for our collaboration. It's a privilege to work with you on this so crucial teams and programs. So.
Yeah. We have already made a webinar before, and we have discussed quite a few things about resilience and how ancient Greek philosophers were discussing the themes. But today we are going to go deeper, I think, into the resilience theme. And so I would like you to start by defining exactly what is resilience, okay? What is female resilience specifically, to start with.
Right. Yeah, thank you, Maria, for this first question. We have discussed about the definition of resilience last time, but it's important to start from there once again, because starting from definition offers us already a clear perspective of what this means, and to step away from the buzz meaning, the common misunderstanding of resilience that we may encounter when we read these terms around. So, for instance, if in the Cambridge dictionary, resilience is defined as a quality, the characteristic of a substance to return to its initial shape and form after being bent, pressed, after being undergone a huge external pressure. And so basically it's referring to the elasticity of a substance, of the matter. Then if you look intensely into the American Psychology Association, they define the resilience as a process, an outcome so process and outcome of people that successfully engage in life after having gone through mental, emotional, physical difficulties and setbacks and adversities. So here there is again this notion of coming back successfully, and in terms of flexibility, adaptation.
To changes in the environment, huh?
Yeah, to respond to an environment in a way that is successful. The adversity also of the environment, of the condition, external condition, in a way that is anyway successful. And the words are always adaptation, flexibility, elasticity. And that's interesting, because often when we hear people talking about resilience, there is often a misunderstanding or misconception, thinking that resilience is resistance, rigid, resistant to something happened. It's like resisting something. Here it's on the contrary, you are talking about adapting to not only to survive, but even to thrive and to go even into success by overcoming the challenge. So that's an interesting point to make already from the beginning, right? We need to embrace this flexibility as a core skill. And another thing I want to say about the definition about the notion of resilience is that can be very contextual. So resilience has a general connotation, of course, but when we go and look at it in studies, in the research of many that have studied different environment, you can say that it's context dependent. What does that mean? A simple example, the resilience of someone living in a big metropolis is very different from the resilience of someone living in a rural environment.
Yeah.
Right. So that resilience is specific, has specific qualities related to the context. And that's why we are talking here today, and we have developed a program about specifically resilience for women in health.
In healthcare, yeah.
So what are answering the question, and to what are the profound needs? What are the pains? What are the skills we need to acquire to become resilient for women in healthcare, specifically?
Okay, there is a 2020 survey of the United Nations that says that 19% of all people have some source of some sort of gender bias against women. And so we are discussing in our program especially the female resilience. How do you see that this is important then? And what does it mean, the female resilience?
Right. Historically, if we look back at history, short look back at history, women were the glue of the communities. What does it mean? They were working silently sometimes, very often unseen and invisibly, working to the tapestry, making the tapestry, the interconnection, the collaborative, the cooperative work in the society, in families first, in the first nucleus of the family, but then in larger community and in society as a scale. So this capacity of creating community and connection is a natural capacity of women that today we are seen as not boosting, as not flourishing like before, because the character of our society is fragmented. We feel a lot of separation in our society.
Yeah. Yeah.
And so reconnecting to this foundation, fundamental capacity is this fundamental capacity of women to create connection is one fundamental core of creating resilience in the environment, the context we are working on. So,
but we don't have it right now. I mean, this networking that used to exist before now is very scarce. Everybody is running to take care of her responsibilities, and so the networking is not really a theme. What else do you think
absolutely.
is characterizing our?
Is lost, and we women ourselves, somehow we lost the connection to this great foundational capacity we have. We are kind of disconnect from our power in that matter, in that context. And so that's one of the things we need to reconnect to, right? We need to reconquer as a woman, not as a leader capacity, right?
And of course, everything is changing so fast. Isn't that so? I mean, when we think we are adapted to a situation, then everything is changing quite suddenly, and then we have to do it all over again.
This is, you are touching now such an important and crucial point because the need of resilience, and especially for women right now, is tapping into the challenging of the times we are living. These are rapid change, extremely rapid change times. If you think that when I was a child, the computer didn't exist, and now we are video conferencing, right? So imagine how much adaptation, upskilling ourselves constantly to cope with changes, not only at technological level, but in the behaviors, in the values, in the beliefs we are confronted to all the time. So we are constantly responding to a changing environment and responding to the implicit question, am I able to do it? Am I able to cope with it now? Oh, now another challenge after the other one. I just conclude this and now there is another. So we are continuously,
trying things,
bombarded by this implicit message. And so this is the so-called VUCA world, the world that is changing at a very rapid pace. And in healthcare,
we know that.
You know how much
firsthand.
it's impacting all the time in your life, and the dynamics, they're extremely rapid. And secondly, there is another element I want to bring, why it's important, is the fact that we, together with this characteristic of the modern times, there is also a paradigm shift. What does it mean? Our mindset, our systems of belief is changing. Is changing, and also in science, in research, in healthcare research, we are moving from problem focusing research. What is dysfunctional? What the questions we are traditionally asking ourselves were, what is dysfunctional? What is not working? What is the problem? What are the consequences of the problem? And this is still valid, but there is other questions emerging that are more empowering. But they require also upskills of our capacity to deal with the reality. And the question are, what are the resources available in me and in my environment so that I can respond successfully to this challenge? What is already naturally available that I don't see, but now can be unlocked So the perspective is different from scarcity mindset to abundance mindset, we said, where there is a belief that there is something in our system that can respond adequately to the challenge, and we need to unlock it.
Yeah, we have to find it,
We
though.
find it, and it's
And
called a competence-based, strength-based approach to challenges.
yeah, yeah. Okay, okay. But then if we have it inside us, okay, then we as women, let's say, how we used it, this resilience factor in the past.
Yes, in the past, we of course we had different roles as women. So and
Yeah.
The woman was more, let's say, along history. We are talking about millennia, of course, but it was the housekeeper, let's say. Yeah, it was dedicated to the caring of the space. So care, and not only care was the biggest offering and giving, natural giving of the woman, their natural supportive capacity, because it is a capacity, it is a skill, it is a value-based capacity. So that was clear what happened in the past. Nowadays, women have so many roles. It's not only anymore the housekeeper.
Yeah.
So
That is
there
true.
are so multifaceted roles, engagement, and this is making the caregiving very complicated and articulated. And so we need to look at the system of around ourselves, becoming aware of all the elements of our caregiving, let's say.
Yeah, yeah. You know, this characteristic of ours, the care that you mentioned before, makes women decide to work in the healthcare more than men. And there are a lot of studies showing that, let's say in STEM, physics, mathematics, and engineering, women are only 28%, but in the healthcare, it's almost triple the number of women. There are more women in the healthcare than men, actually, because I think of these characteristics that we need as a gender to give care, to work on the care of others. And so this is quite a fact for our VUCA work that you mentioned before. So all these women who have the care of the house and also have the care of their patients and in clinics and in the workplace. So how do they can combine those two different kind of care?
Yeah, that's such an important question and crucial question. First of all, I'd like to say that with care comes the profound attitude, empathic attitude of women, the capacity to relate, the capacity to create connection. All these elements are part, a natural talent that converge into the care, interest, and offers of women. And not only in the profession of healthcare, but also in our family, in our private life, right? So this is the great gift we have.
Yeah, yeah.
And it's also our dedication. It becomes very often our dedication,
Exactly.
our mission,
Our purpose of life. Yeah,
our
exactly.
call. Yeah.
Yes,
So
yes.
at the same time, yeah, maybe you wanted to comment on this, Maria.
Yes, I just wanted to say that from one part is the personal let's say, situation that we have to work on, also in the house and in the workplace, but then we have to work in a whole system. We are part of a system. And so if we don't, if we are not resilient ourselves, or if we are exhausted, then what is happening to the system?
Yeah. That's a very interesting question. And let me say, before going into that there is this empathic skill and care, profound care attitude that we naturally have as a downside, a counter effect, and which is the fact that very often we forget about ourselves while focusing on caring for the
for the
other,
others.
for the environment. Yeah.
Mm.
And so when we talk about the system we are in, for instance, the healthcare system, our professional life, our family, we tend to forget to include ourselves in the system. So very often we find ourselves being empathetic and supportive for the others, but sometimes we forget to be empathetic to ourselves.
Yeah, that is true. That is true.
And that's one element that can cause a serious impact in the so-called emotional labor. The healthcare is a high stress environment that requires a very high emotional labor. So what does that mean? It means that we are not executing tasks automatically like a machine. There is always an emotional engagement and involvement in the healthcare professional. Well, and how does this manifest? Well, we have said just always engage in empathy and compassionate relationship with patient, with their colleagues, yes. Then there is at the same time, there is the need to emotionally regulate ourselves, because we at the same time we need to appear like in control of the situation.
And professional. Yeah.
Professional, sometimes tactful. So we need to control also this aspect emotionally, right? At the same time, we need to be into positive interaction, meaning encouraging, for instance, the patient to take care of something that may not be immediately welcome. There is so the conflict management part that comes in all the interaction with the patients, the families,
the colleagues,
colleagues, etc. Because of the high stress environment, sometimes conflict can escalate, right? And so there is all this supportive role that requires continuously emotional engagement. This aspect of the work is often systemically, and that's one of aspect of the system
we are discussing
dynamic that we are discussing. This emotional aspect of the work is very often it goes not seen, it goes unseen. It stays unavailable, it stays not mentioned openly. And this means that is also unmanaged. So it's not managed well.
If you don't see something, you don't do anything about it. Yeah. That is true.
Right. If you are not conscious of all of the importance of this dynamic beyond the executions, it's something that can affect heavily the system, and starting from the individuals, the professional working, right? And then side effect. What are the effects of this unmanaged emotional labor? Well, first of all, emotional fatigue.
Yeah. We know that, yeah.
Compassion fatigue. There is something called a compassion fatigue. Dissatisfaction about work.
Yeah, yeah. And before COVID, before the pandemic, this was at a level of 50% for the physicians and a little bit less for nurses. But now, after the pandemic, this has come up.
Yeah. Yes, and during the pandemic, there was another effect of this overexposure to emotional labor, like something became chronic, and so there were also mental health issues arising, right?
Yeah.
Such an anxiety,
Depression.
depression,
Yeah.
and to the extreme also to the burnout, which
Mhm.
is clearly emotional exhaustion,
Yeah.
depersonalization, the profound disconnect from yourself, from your fundamental needs even.
Can you explain this a little bit more? What does mean depersonalization and how this affects the job, your work?
Yes, so we have mentioned a little bit before how when there is this when you are engaging in the different aspect of the emotional labor, being compassionate, but at the same time being in control, managing continuously conflict. Your attention and your focus is always outside yourself. It's so always for the others and for the environment,
Okay.
to the point where you may forget about yourself.
Yeah. Yeah. And
You
then
care there for the others, but you don't care for yourself.
yeah.
This care for yourself can happen at different levels, of course, mental, emotional, physical. Yeah.
Yeah. And then
So
you don't recognize your sentiments and your emotional state, maybe, yeah?
yes, and the center of your being is displaced. You don't access anymore your own resources. You go into an automatic
Mm.
machine type of behavior that is exhausting
Mm.
because it's suppressing constantly the personal needs of
Yeah.
self-care.
Mm.
You
Okay.
know, there is a metaphor that can really speak about that. There's a metaphor in the plane when they are giving you the instruction for possible emergency during the flight, because what they say typically is this: first, put your oxygen mask, your own oxygen
Mm.
mask first,
Mm. Yeah. Yeah.
because otherwise you cannot help others
Mm.
if you don't first think about yourself, take care of yourself, right?
Uh,
So
nice metaphor, yeah.
yeah, so that's can help to understand the dynamic that can help, and these are impact at individual levels, like burnout, depersonalization, when is taken to an extreme, but can come just as increasing dissatisfaction with the job. You are not
Yeah.
happy of
Yeah.
doing what you before.
Exactly.
What there is a disconnection between your sense of mission, your calling, but the actuality, the reality of the everyday work, and that there is a you become disappointed,
Yeah.
dissatisfied, right?
I know that from first hand because I was also in burnout before the pandemic. Yeah. And it was quite complex to overcome this.
Mm.
And of course, we know that the system is suffering from people that are in burnout.
Yeah.
What are the consequences
Yeah.
of this to the system?
Absolutely. What you said immediately cannot be a problem that is only individual problem, right?
Yeah.
It has immediately a domino effect on the system. So on the patients, it's jeopardizing the health and impacting the health of all and the functioning of all around you, colleagues, peers, and of course there are impacting problems then at the level of human resources, at the level of productivity, at the level of
cost.
efficiency. The systems start to have delays, right?
Yeah, that is true. Yeah.
Which is an important parameter in healthcare when the dynamic is very fast, and especially during the emergency, right? Or even during the daily activities. So the system is immediately impacted by the level of resilience by every single one. And so this is part then that we call, there is a notion of, then this is the notion of systemic resilience, the resilience of the system.
And there's a cost for this, because I have read some days ago that there is also a cost around $5 billion to overcome the issue of burnout in the healthcare sector. And specifically, it is, let's say, $500,000 per person who is at the stage of burnout to overcome it, which is quite an amount of money for the system.
Absolutely, absolutely, and it's huge economical waste.
Yeah,
If you want to look at
exactly.
this side, and economical cost, and there is a lot of prevention needed,
Yeah.
especially so.
Yeah.
And cases of burnout are increasing also. For all the reasons that we have mentioned during our conversation, and because resilience is something that we need to learn and cultivate, and
Yeah.
and
But are there different types of resilience that we need? I mean, do we need something for today? Do we need resilience for long-term events? How do you see that?
Yeah, this is an important distinction, and it relates very much to leadership, to female leadership. So there is something called acute resilience, which is the resilience that we need day by day to face the daily challenges. How we do well, how we perform well, and at the same time taking care of our well-being every day, daily, right? And then there is another notion of emergent resilience. An example is the pandemic. So a big event, a big happening, sometimes can be in the life of a person, like a trauma, the loss of a beloved one. Yeah. So something big that is eating
Our resources.
our resources, our lives, sometimes unexpectedly, right? And that can create shocks in the system or in our life, or traumas. So that is for and it's another dimension, another size of we are talking about, of course. But both acute resilience and emergent resilience need a leadership capacity, a leadership vision, which is connected to the preparation. We need to prepare for it. We
And
need to
prevent. Yeah.
prepare to prevent, right? So it's like preparing ourselves both for the acute resilience, for everyday resilience, and prepare ourselves for because life happens, for possibilities of a bigger event that can arrive in our life.
Yeah.
And
And
especially,
also the system has to find its way through it. Also prevention for the whole system
yeah,
and preparation
yes, the system resilience, individual resistance, they are feeding each other. The
Yeah.
individual resilience contributes to the
to
system
the,
resilience, and the system in terms of infrastructure, in terms of awareness, in terms of interconnectivity of resources, is feeding all that,
It's a
supporting
circle.
individual resilience.
Yeah.
So they are mutually interdependent, and we need to take care of the two aspects and be conscious about the two sides of the resilience in this in this.
And of course, there are a lot of things that the system could do, because we have studies that shown that people who are estimated well in their job and they feel that they others acknowledge their work, they feel less the problem of burnout, although they may work a lot, although they may work a lot of hours. It's a lot of factors that contributing to this, and the system should really do a lot of things about this matter too.
This is so important for, especially for women, to be recognized and to be seen.
Yeah, yeah.
And it's also related to one of the key pillars of resilience we have talked about at the beginning of our conversation, which is about supportive community and connection with mentors and connection with mentorship and continuous learning to be seen and to know ourselves better in that in the challenges we are facing every day, in fact.
Yeah. And then except of these things that we have already mentioned, let's focus now on the pillars of resilience that we have designed for the program. Let's make a repetition of the first three, and then let's see if there are more.
Yeah. So the program is developed around 9 pillars of resilience. We call them the 9 C's. And so far, we have talked about community. C as community.
Very important, yeah.
We have talked about consciousness, about conscious of ourselves, of our inner game. It's called the inner game. What happens inside us, our emotional labor, and the system, awareness of the system. So consciousness is the second C, and third, we have talked also about connection, the ability, the supportive of mentors that can help us to cultivate our own resilience, to develop skills, to guide us into the direction that are meaningful for us, and so that we are seen also.
Yes. Yeah.
So this each C, each module, each key, which pillars correspond to a module in the program. And so these are the three we have mentioned so far, and we have talked about. There are others, other 6 actually.
Yeah, let's see. Yeah.
And one other is certain like competence. It's about, again, we have mentioned also this during our conversation today. It's about personal mastery, emotional intelligence. So as essential competencies for building high resilience. Yeah. So another C, the 5th C is contribution. Also, this we have touched a little bit in our conversation today. The sense of meaning we have for what we do.
Or what do we do? Yeah.
Meaning making through our work, contributing in a meaningful sense. This offer us really a pillar for our resilience. Despite chaos, stress, worry, sometimes despair, we know what we are doing as a meaning. We can contribute.
Yeah. And what else? What else do we need? We need.
Yeah, so we said, we mentioned at the very beginning in our definition, we talk about elasticity, flexibility.
Yeah.
The C that correspond to this aspect of the resilience we started with is creativity.
Yeah. Yeah.
Creativity and flexibility is something essential to find new solutions, to find new ways, solving challenge in an original way that is innovative, and so that we are not repeating the old same that is not valid anymore in front of a change or in front of adversities. So creativity is crucial again.
And most of the times we hide this.
Yeah.
Because we don't have the
To
time.
repeat the same hold. When there is a challenge, we to repeat the same hold. That doesn't.
Yeah.
Yeah.
And
there was a famous sentence of Albert Einstein who say, "We cannot solve the problem of today in the new problems with the mindset, the old mindset of
all
yesterday."
minds.
You know?
Yes.
So this
Yeah.
was a famous quote from
So we have to change the mindset, but
yeah, the attitude and the way we look at things and the perspective, but so find new way really. So the other C's that is also equally important is communication. Communication.
yeah. Yeah.
We tend to underestimate how we communicate, the power of communicating, of communication with ourselves and
And
with
the others.
in
Yeah.
the environment. The ability to convey appropriate and effective messages is really at the core of resilient relationship and environment. Communication is again
Very, very
another
important.
pillar. Yeah, yeah. We also work a lot about commitment, the other C, the 8C.
Yeah. How do you mean that?
Yeah, it's committing again to a personal goal, to
Yeah.
a specific project. Stay committed to our values in what we believe is make us strong, make us resilient, make us solid in what we do. And offer us always a reference point in times of chaos, in times of doubt. Yeah.
Yeah. Yeah.
So then the ninth, last but not least, C stands for care. Care.
Yeah. What else?
Start from it, and we end with it, but that's really at the core of resilience, a sense of profound care for ourselves,
Self-care. Yeah.
for others, for the environment we are in. This is so crucial to navigate the difficulties, the emergencies, the setback. Yeah. So these are the 9 C's, the 9 pillars. I hope we can talk more about some of them more in the next webinars, Maria.
Yeah. And what practical tools we have to enhance all those pillars. But for the moment, let's say, what can we say to our participants about practical tips that they can gain out of this webinar? Let's mention them again if you want.
Yeah. So it's crucial nowadays to cultivate resilience in our profession and in our life.
Mm.
Yeah, especially we women with our multitasking, multiple roles life need to upskills our capacity to thrive in our environments, facing challenges every day. So this program offers, first of all, practical tools, concrete practices to reduce the stress level every day, and while at the same time enhancing the job performance and taking care of yourself, so enhancing your well-being and satisfaction. So there are different elementary, and it's important because there will be not only a theoretical course, but will be really offering exercise, practicing to integrate in our everyday life. So basically preparing for acute resilience, like we said, and for emerging resilience.
Yeah.
And this will bring us, I have to say, this will bring us a boost in confidence. Women.
And what else
And
do they get?
yes, to the confidence to step up in our career development, to make choices in our career with more lucidity, with solidity, and contributing to more gender diverse leadership in healthcare. Highlighting, making visible our true power, feminine powers that we are so talented in care. All right. So
that's so nice that you are mentioning.
Become visible.
Become visible.
Become visible and impacting the system,
into our workplace. Yes.
capacities.
Yeah. Huge gains. And let's say in 3 months, do you think we have the time to cope with all this and come up with let's say a new mindset that you mentioned before?
Yes, look, this will be a 3 months program. What does it mean, a 3 months program? That it is an introductory program, a foundational, creating the foundation for everything we said today. So, and this means that we'll give really the very basic, the foundational basic to step into this, enhance capacity, enhance leadership, and boost all these skills.
We are also very keen, and we are working on the network issue, which is really important. You have mentioned it before that the networking is a paramount factor for the resilience of women, and a supportive community is really, really important.
It is absolutely. This will be important part of the program, because we'll have shared space where the participant can come together and share their experience and support each other so that we overcome that sense of loneliness and aloneness that sometimes we have in our challenge. Sometimes we tend to withdraw and feel alone in it. While opening up and feeling the others may have similar experiences, or anyway can offer us support, is change making. It's change making. The community is change making. Yeah.
Exactly. And we are counting on this. We are counting on this. We are working on this, and the fact is that there are a lot of groups that they try to organize a community, but not specifically in female healthcare sector. So we want to grow this fact through research, through the academic profile of the program, through all the tools that we have as academicians, you know, to spread this knowledge, to spread this new mindset for our VUCA world.
It's, you know, for someone that facilitate processes of collective intelligence, I can say that this is not only offering support, but is offering so much resources in terms of problem solving, in terms of finding new way, in terms of thriving, validation, recognition, which is something we
need.
we need, we
need, yes.
So it's really a tapping into the collective intelligence of women.
Mm-hmm. And as I said before, we are almost double the workforce of men in the healthcare sector. If we actually knew the strength that we have as a group of people, you know, that we could work together and empower our roles in the healthcare sector, then the whole system would have been more resilient. Isn't that so?
Yeah, absolutely. Absolutely, yes. That's what we are doing. Try to wave again.
Yes,
tissue,
yes.
the tissue of the
Yeah.
community life. Yeah.
Yeah. And enforce this group. We can make a lot of things in our sector if we only knew how to collaborate and work on our roles in a better way and more resilient way. Okay, so I really am very fond of this program. We have worked a lot about the scientific base of all these things that we're going to share, and I am very optimistic that we can really grow this community.
Yes, it's something I invite you, everybody who is listening to us, to tap into, because it's life-changing. It is life-changing. So don't hesitate to step into the power of this program.
Yeah, and you know, all people who are quite, you know, they have a name in their field. They have coaches behind them to push them. They have mentors, and this part of coaching and mentorship in the healthcare sector is really needed. We have done a study for our students, of course, but I think we will prove that it's also true for the professionals in the field, that they need more, almost over 60% of them, they need a coach, they need a mentor to help them through these obstacles, through these adversities that you mentioned before. So let's find a way to help ourselves.
Yes, yes. Mentorship is at the core of growth.
Yeah,
We want to
I
grow.
believe that.
First of all, naturally, we human beings, men and women, want to grow. It's a natural predisposition to life that want to expand and grow into something more, right? Or higher.
Yeah.
But sometimes we feel blocked, we feel stuck in a situation. Sometimes we are lost in the system and we don't see a way
Yeah,
out.
exactly.
We withdraw as a natural, we fly away, or sometimes we fight. These are kind of responses, but we need to learn our inner at the game, right?
Yeah.
So that's the mentorship helps.
So for whom do you think it's important, this program? Which kind of women?
Yes, well, what I just mentioned, for instance, women that feel lost, in the system, they start to lose their motivation. They feel start to feel a fatigue, or they are already heavily
No.
feeling the compassion of fatigue already.
Yeah. Or in a burnout. Yeah.
Yeah, there are consequences of the emotional labor. And women that feel the need for recognition. They need to be seen, to be recognized in the work they do every day, both at work, in professional setting, and at home.
Yeah.
Because what we learn in this program is applicable not only in the professional context, but also when we are going back home, right?
That is true. That
So
is true. We are discussing about the system. So
there is no separation at the end.
yeah.
We are, and so simply a person that want to embrace a career, a new career, but does look around without seeing how and what precisely, that confused about her next steps.
Yeah.
To advance in her career and want to advance more leadership skills. So these are all the elements and the why that we are answering in the program, and how, of course, how to do that. Yes.
And we need for once to, come out and discuss these things in a scientific base. Yeah. So,
Yeah.
so thanks a lot, Alessandra, for also this nice discussion we had about the resilience, the female resilience. I also thank our participants, and I hope to see all of you again in our next actions. The next webinar will be on the 18th of September, and hopefully in our program too. So thanks a lot.
Thanks everybody for being here, and so I guess all the links for having more information are in the chat.
Yes, and we will share them also through other means of communication. And so until next time that we meet, bye-bye, everybody.
Goodbye. Bye, Maria.
Bye.